Hello, my name is Adrianix, and I'm here to see the genetic counselor, which is you, obviously, and my wife isn't here. She has some urgent business to take care of, and so...
Hello, my name is the Nutty Professor. What brings you here today, sir?
So, my family, me and my wife we're thinking of having a child, and we are worried that they might get sickle cell disease, okay? So, my brother, he has 2 children that have sickle cell disease, and my wife has a sister who has sickle cell disease as well. And so we were wondering what the chances are of our child getting sickle cell disease.
Well, with that in mind, allow me to show you something.
There you go. And of course you. We have your family over here. Your mother, your father, you and your brother, his 2 sons, and whoever he married. So we know that your sister has the defect along with your brother's 2 sons. And so by this, we can safely assume that he most likely had the trait. So we can mark him with the trait. And if he had the trait, since this is genetically passed on, we can assume that either your mother or your father had the trait. So we can assume that, worst case scenario, they both had the trait. And since your sister had the defect, we can safely assume that your mother and father both had the trait. Otherwise, she would not have had the defect. Now,
if this is true for this, would your brother's wife have the trait also?
Yes, actually. Well, actually, there's 2 possible options she could have. She could either have the defect itself, which could make it a 50-50 chance of passing on the trait or the defect, or she could just have the trait. But either she has the defect or she has the trait. So I'm actually glad you brought that up. But now, at this point, until we do like a gene test on you 2, we won't know for certain, but we can presume, using what we know of the defect, that you either have a 25, 50, 25% chance. So we'd have 25% chance that either your kids might get the defect, a 50% chance they would have the trait, and there's a 25% chance they would be completely fine with no trait at all. But we also don't know if you inherited the trait yourself, because again, if your parents had the trait, there's also that 25% chance that you may not. And in which case it becomes that 50-50 we were talking about earlier. Again, much better than, well, the 25-50-25, less chance of problems. At this point, unless you get yourself tested, you can only, you can decide to have kids or not. You won't know for certain if you have the trait or if you don't. But if you don't want to and you want to go ahead and have kids, I'd recommend you hope for the best but prepare for the worst. After all, there's at least a 75% chance that if you both have the trait, they'll be perfectly fine. But
I'm back. Children born with some symptoms are children that are born with sickle cell go to the doctor before they're 8 weeks of age, and then they go see the doctor regularly every 8 to 12 months. And so children below the age of 5, though, are prescribed penicillin, and it is usually taken 2 times a day, as it's been seen to reduce the chances of severe infection by pneumococcal bacteria. People with sickle cell are also recommended to take multiple vaccines of any kind, such as mainly pneumococcal and meningococcus. And meningococcus, though, is taken at the age of 1, 2, 4, 6, and 3 years after that, they take a booster shot, and then 5 years every other.
That is just the treatment. I need the cures.
So there is one cure, you could say, it has an 85% success rate, and that is bone marrow donor. And bone marrow, they have to have, so for this, people have to have the same bone marrow. They can't have sickle cell disease, obviously. And the bone marrow, being that it produces the hemoglobin, will, when you transplant it, it will produce normal hemoglobin again. And so this is risky because due to the chemotherapy, this lowers the white blood cell count, so patients are even more prone to infections, and some infections, in fact, from the lowering of white blood cells have led to a